alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Ant2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency. We're servicing Palm Beach County, Broward, and Miami-Dade. Our phone number is 954-717-7027. I'm your host, Louise Gomez, and today we have Dr. Dennys Reyes Candedo, and he is at, you can reach him at 561-499-7551. He is at the Palm Beach Neuroscience Institute. He is an interventional neurologist. And the address is 8756 Boynton Beach Boulevard, Suite 2500. And that's right here, Boynton Beach, 33472. Also a location in Delray, 16215 Jog Road on the second floor, Delray Beach, Florida. Thank you for joining us, Dr. Candedo. We appreciate you coming to the show.
Thank you so much. Thanks for having me.
We know you're busy, and we appreciate you taking your time out. And so I usually like to, kind of introduce you by asking you, a little bit about your background and, where'd you go to school and what made you want to become an interventional neurologist?
Of course. Yeah, I was born and raised in Cuba, actually. Started medical school in Cuba, and then I moved to Dominican Republic. That's where I finished my medical school. And then I moved to the U.S. And did an observership, research, and finally neurology residency at the Cleveland Clinic in Weston.
Nice.
Which is down the road. That was for approximately a total of 5 years. And then I went to Washington, D.C. for about a year, where I did the stroke fellowship.
Oh, okay.
So yeah, I got exposed to great research from the NIH, Bethesda, Maryland. It's a beautiful city.
Nice.
So you get exposed to different environments, including a suburban hospital belonging to Johns Hopkins, and another one down in Washington, D.C. called MedStar George Washington. And then I moved to Miami, to Baptist Health,
Nice.
South Florida. And for 2 years I trained for neurointervention, which basically means you train to do procedures to repair the arteries of the neck and the arteries of the head. Typically through the groin. We navigate catheters and wires, and that's how kind of we repair the vessels, to make it more simple.
Nice. So you said you did a lot of research. Did you have any mentors when you were studying?
Yeah, I had quite a few mentors from the beginning.
Nice.
From Cleveland Clinic, of course. One of them was Dr. Salgado. He was great. And then I had another one in Washington, D.C., Dr. Lynch, and then a couple more in Miami, Dr. DeBuza and Linfante. Yeah. So.
Nice. So, Doctor, can you explain to our listeners a little bit more about the cerebrovascular disease and how is that caused and what does that mean?
Yeah, certainly. It's quite an impressive disease. Approximately is our fifth leading cause of death, actually, in the U.S. So 87% of patients that suffer strokes, what we call a stroke itself, it happens because of vessel shutdowns. So either a big vessel, medium-sized vessel, or small happen to shut down. There's not more blood flow into a specific part of the brain, so they develop symptoms, which could be weakness in one part of the body, or it could be lack of speech, loss of vision, loss of balance. So, and then there's 15% lower percentage of where the blood vessel, instead of shutting down, it breaks and it leaks blood into the brain, and it pushes on the brain, and it causes similar symptoms, just that it could actually cause a lot of headaches nausea, vomiting in addition to it.
So you said it shuts down. Does this progress slowly over time, or is this?
Yeah.
I know when someone has a stroke, unfortunately, my mom had a stroke, and I know it's sudden. It was a sudden event.
Pretty much.
But is that something that occurs slowly over time, or how does that work?
Not typically. The word stroke comes from term apoplexy, which I think the Greeks used to call it like striking by the guts.
Right. Right.
So it's, in a way, you get the feeling that it's a sudden, right? It's a sudden
Right.
problem. The vessel shuts down. The first thing that happens is the functions shut down. It's almost like you shut down the electricity in the
Right.
house.
Yeah.
You still have the structure, so you can put the electricity back if you restore the blood flow, but you just shutting down the electricity all of a sudden. So the functions in certain parts of the body will shut down suddenly by the lack of blood flow into a specific part of the brain. Yeah.
So who would be at risk for this type of illness?
I would say pretty much all of us.
Oh, God. Like in my personal, like my mom had high blood pressure.
High blood pressure.
So is that like a triggering effect?
Yeah, that's what we call probably the biggest deal actually. 80% of strokes are caused by high blood pressure on the long run. Yeah. So then so having high blood pressure is a big deal.
Right.
Then also high cholesterol. That's another one. Having sugar problems, such as
Right.
diabetes, we know that, right?
Right.
Smoking, that's
Right.
another one. Excessive alcohol intake, that can, those are the most common things that we learn about. Certainly in your patients that have sleep apnea, for example,
Oh, interesting.
secondarily, they have a tendency to develop high blood pressure, high cholesterol, and diabetes as well. So that's kind of also obesity is in the grounds of all of it.
Right.
Obesity affects sleep apnea, but also makes you susceptible to have strokes. And then that's in the more of an older population, of course. But younger folks, yes, they can also have strokes.
Wow.
Which happen to be related to some of these risk factors as well. Earlier in their life, we think might be related to habits,
Lifestyle habits?
lifestyle habits. The diet might not be correct, Smoking might be a problem.
Right.
Some of them might be exposed to certain drugs, right? Drugs are not good, such as cocaine, for example. But there are other conditions. In women, for example, migraines is a very common scenario where migraines does carry a little bit higher risk to have a stroke, especially if you're taking oral contraceptive pills. So that's something that we always keep in mind. It doesn't mean that if you're a woman, you have
Sure.
migraines, you take oral contraceptive pills, you're going to have a stroke. That's not true,
Right.
but you do have a higher risk
Sure. Sure.
to have. So we just manage risks, so on and so forth. There's a condition also called PFO, patent foraminal valley, where there's a hole in the heart, which is very common actually.
Are people born with that?
Yeah, people are born with that, and
wow.
it's so common that 1 out of 4 people will have it.
I've heard of that.
It's very common, very common.
So that increases your risk of stroke?
Yeah,
because
so
of that?
if the hole is pretty big, let's say, this person XYZ is flying 12 hours, develops a clot in the legs,
Yeah.
and then that clot flies through your venous system. It can actually cross through the hole and go up to
Wow.
the arteries in the brain and shut down. We have seen it basically.
Sure.
It's not something, not everybody that has a hole in the heart is
Right.
going to have a stroke.
Sure.
The same way that not everybody has atrial fibrillation is going to have a stroke, but also atrial fibrillation is a big deal.
So AFib, is that where, can you tell us about that? What is
Yeah,
that?
AFib is arrhythmia of the heart.
Okay.
Cardiologists, they manage
Got
it
it.
very, very often, right? So the heart actually goes from pumping into, to put it in a way, that it goes to shaking, in a shaking
okay.
mode kind of situation. And the blood is not flowing. So when the blood is not flowing, it has a tendency to clot. So during that time, it can create a little clot. And
Right.
then once the heart goes back to pumping, then the clot shoots up through the arteries and basically it shuts down an artery. And that's one of our biggest deals in at the hospital that we see at the Red Medical Center.
Oh, okay. So that's
Yeah.
there are high incidences of that.
Yeah, it's because we see that a lot, especially after the age of 80.
Mm.
It's very, very common. It's almost half of 50%
Really?
higher risk of developing, of having the condition itself, even as in a silent mode.
Wow.
Yeah, you might not feel anything, but you might have AFib. Yeah.
Interesting. So, can you tell us what is the distinction between an aneurysm and a stroke, or is there a distinction?
Aneurysm kind of falls within the risk of developing stroke, but on the bleeding side.
Okay.
So if an aneurysm is more of an outpouch of the wall of the vessel.
Okay.
A wall of the vessel, for whatever reason, there are many reasons, including again high blood pressure,
Sure.
cholesterol problems. There could be bumpiness, irregularities in the artery, which
Okay.
eventually might make the wall of the vessel weaker.
Okay.
And then with that blood pressure over time, the wall of the vessel grows to create a little balloon outpouch.
Mm.
And then it could stay that way or it could burst. If it bursts,
Right. Yeah.
then it causes a lot of trouble. Yeah.
So I have a question. What if somebody's having a stroke and they are alerted right away, they get to the hospital, what can be done for them as far as,
Yes.
as soon as they get to the hospital?
Typically, the first thing that we do is plain CAT scan, plain CT,
Okay.
kind of to differentiate what are we dealing with. Are we dealing with a bleed or is not a bleed?
Okay.
That's probably the biggest step that we do. But before that, a few things happen.
I was going to ask you,
So-
can we backtrack and go into
Yeah.
what is going to occur? Like if there are listeners out there who are
Yeah.
listening and they're taking care of their elderly parents, what should they look out for a stroke? Let's go into that.
Certainly. So first thing, we use a lot the mnemonic of be fast. And this is something that we want our community to learn about,
Okay.
to be educated. And this is not something for just friends or family or
Sure.
adults, even children.
Yeah.
Even grandkids, I think they need to know
Yeah.
the mnemonic of potential signs of symptoms of stroke. So we follow the mnemonic called be fast.
Okay.
So B stands for balance.
Okay.
So anyone having balance problems.
Right.
E stands for eyes, the patient developing all of a sudden vision problems.
Mm.
F then stands for face. There's some sort of facial weakness somewhere or asymmetry on the smile.
Right.
A stands for arm. If there's
Okay.
weakness on one of the arms or so. And then the S stands for speech. There's some speech difficulties, slurring of the speech, patients having trouble comprehending
Yeah.
or putting the words out as well. And then T stands for time, which we want you to call 911.
Uh-huh.
So that's the first step before the patient gets to the ER.
Right.
Identifying the patient that is having stroke-like symptoms and then making the right decision, which is to call 911.
Right.
We have uncountable cases where they drive to the ER,
Right.
and they should just be calling 911 because you want to save time.
Mm-hmm.
Every minute that we lose, it's approximately about 1 million to 2 million neurons that we're
Wow.
losing. So it's a big deal.
Every hour that we lose is approximately 1 million neurons. Wow.
neurons,
So we've
yeah.
got to get them there right away.
That's right.
And then as soon as they're in, are there any new medications? I say new, I mean, I haven't,
Yeah.
what are the medications, I guess, that you would give to a patient if you know that they have a stroke right away? What would you be giving?
Exactly. So back in the 1990s, we got first clot buster medication that was approved at the NIH at the NINS trial. It was the TPA,
Okay.
which is a clot buster medication again. It breaks down any possible small clots and kind of
Okay.
cleans the arteries and restore it back to normal. So you want to
Oh.
restore the blood flow back to where
Okay.
it was before. So, but you only have
A window of time.
a window of time.
What is that
exactly.
window?
So it's only up to 4.5 hours that we
Okay.
have to give it. So that's why we don't want, it's all
Yes.
about, we go back to the basics of the
Sure.
mnemonic, and the be fast, because we really want you to be as fast as, reacting to what's in front of you and calling 911 so we can get that the first CT scan that
Right.
shows no bleeding at all.
Right.
And that's kind of giving us the green light to give the medication.
I see. So once they're administered that medication, does that reduce their risk of permanent damage, or what does that do?
Medication is not perfect.
Sure.
But 30% of patients, based on the trial, shows that they got better.
Okay.
Another 30% show that they remain about the same.
Okay.
But
so
they didn't get worse.
They didn't get worse.
They didn't get worse.
Right.
Unfortunately, another 30% did get worse, no matter what you did. And then 6% patients had a big bleed, you know, with the blood. It's a blood thinner, and it's a strong blood thinner.
I see.
Now we have a new one, though. It's called TNK.
Okay.
Tenecteplase. So it's a little better regarding the bleeding. It's very comparable to TPA. So we have both options nowadays.
Interesting. We're going to take a quick commercial break, and we'll be right back. Thank you, everybody. We'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thanks for tuning back in to You and Your Doctor, and we have with us Dr. Dennys Reyes Candedo, and he is right here in Boynton Beach at the Palm Beach Neuroscience Institute, 8756 Boynton Beach Boulevard, Suite 2500. The phone number is 561-499-7551. Also in Delray, 16215 Jog Road, second floor, right here in Delray. So, Dr. Candedo, we were discussing, I think, when the stroke patient gets to the hospital, I believe we were going to continue that, or I don't remember. Maybe you can refresh my memory.
Yeah, when patient gets to the hospital,
When they get to the hospital,
we follow a protocol which is pretty much recognized by the whole U.S. nation. Most hospitals follow the same protocol, but we get a plain CT at the Delray Medical Center in the ER right away. They're rolling. Usually we get pre-alerted by EMS.
I was going to ask you that. I was going to ask you, like, do these patients get like alert? Do people get alerted so they know, okay, we have a stroke, so we need to get them in right away? So
we
they
have
do get priority.
A great relationship with the Delray Beach Fire Rescue and also Palm Beach Fire Rescue. Actually, I've done education for them regarding strokes or so. And then they will call us. They will say, we have a patient, yada, yada, and they say, we'll explain what kind of symptoms they're coming with. At least everybody knows. So 5 minutes ahead of time. And then ER will check on the patient really quick, and then we'll roll the patient straight to the scanner.
Oh, good.
Get a plain CT first, make sure it's not a bleed.
Okay.
And then the next picture will be a vessel image, to see whether is there any vessel completely shut down or not. And then we have a third picture that we take, which is a perfusion scan, where we kind of evaluate how the blood flow is moving around the brain. If there is a vessel that's completely occluded, how much brain tissue is at risk to completely, you know, not make it, and how much brain tissue actually we can potentially save. Some of that tissue
Oh,
sometimes, you know,
interesting.
not getting enough blood flow, think about it, less than 30 cc's or so, for us it correlates with an area that is possible, most likely going to be permanent damage.
Oh, wow.
But sometimes if we move pretty quick, we
That's good to know.
can save it. Yeah, we have seen good turnarounds.
That's good to know. So anybody who's listening, if they have a family member and they're, you know, worried
Yeah.
about that, at least we know that they're going to be in good hands in the Delray Medical Center, for
Exactly,
sure.
and then learning about the mnemonic, the BFAST, of course, you know, it helps a lot.
It's important. It's important to recognize that.
Yeah, we also have a second type of scan. It's an MRI. We follow wake-up protocol.
Okay.
Even though patients, we might not know when the stroke happened, and
Okay.
it could have been in the middle of the night when they went to sleep. Could have been at 2
Oh.
a.m., 4, 6, 5, right?
I didn't even think of that, right? What
Yeah.
if they're asleep and having a stroke? And,
Exactly. So you don't know
and
what
they're
the stroke happened
alone.
during that time.
Oh,
So they wake
wow.
up with symptoms.
Oh,
We
right.
bring them to the ER. We do an MRI scan.
Right.
It kind of gives us a picture of where the stroke happened, if it happened, and whether 6 hours has passed or not, or a certain amount of time has passed significant to say, okay, we cannot push any medication. But there is a chance that we still can give that medication, the clot buster medication,
Right.
if the MRI is in the favor of it.
Mm-hmm. So, how does lifestyle, like,
Yeah.
what would you say is, you know, lifestyle? How does that play a role as far as
Yeah.
strokes and whatnot?
Certainly. I mean, we know lifestyle changes, especially nowadays. I think everybody's bringing down significant consciousness about what
Yes.
we eat and what's in there in
Yeah.
the food, right?
Yeah.
We question everything that we eat nowadays. I think it's very appropriate
Yeah, for sure.
to understand, because we have seen a trend of, you know, higher increased obesity, of course, overweight, but not only that, then is that itself is coming with high blood pressure problems and cholesterol problems, sugar problems, and then the consequences of all this will be having a heart attack, right?
Yeah, for sure.
Or a stroke.
Sure.
So,
Yeah, I'm curious because as unfortunately obesity becomes more and more, you know, I should say more and more people suffer from that.
Yeah.
Is there an increase in strokes as far as if you looked at studies from the 60s, 70s, 80s, or now? Like, is there an increase, an uptick in that?
an uptake in general, what I would say, it probably remain about the same.
Okay.
It's approximately 600, 700,000 cases that we have a
Wow.
year, even though our population is growing.
Right.
But it used to be the 4th leading cause of death.
Okay.
Now it's the 5th leading cause of death. I mean, it's
Okay.
still a big deal,
Yes.
but certainly it's a problem. And then going back to lifestyle changes, yeah, you got to keep an eye on your diet, right? So I would say American Heart Association
Mm-hmm.
highly recommends focusing on a Mediterranean diet,
Yes.
which is good in rich oil,
Mhm.
right? White meat, they want you to, you know, focus on chicken, turkey, fish, right? Stay away from salt,
Right.
bread, for example, or, you know, heavy oils where they're heavily saturated
Yeah.
food, fried food, of course. You know,
Right.
they don't want you to be touching those things.
Yeah, the
And-
good things.
The good things.
Some of them.
And then, you know, for all of us, actually, American Heart Association would like us to be doing moderate cardiovascular exercise,
Okay.
which is approximately 150 minutes every week. You know, it doesn't have to be intense, but at least
Right.
moderate, where you feel a little bit of shortness of breath.
Sure.
Yeah, so that kind of prevents you from, lowers your risk. The risk is always there, but you can only lower your risk, and that does approximately 30%,
Wow.
lowers your risk by 30% of having a stroke or a heart attack.
Wow. I mean, that's a significant amount if you're
Yeah.
gonna, you know, eat healthy, you know,
Exactly.
exercise, move the body.
Yep, and so
Definitely.
work
a-
on your
a
lifestyle
significant-
changes, certainly, yeah.
So, Is there any new technology that you know that I always like to ask, maybe coming down that they have technology for, I don't know, discovering what strokes are, you know, the rate of people getting strokes, or any type of technology where they would have new medications coming out or anything that is coming down the road in the future?
This always changes, which
Right.
is a good thing.
Yeah.
Technology is what actually helps us a lot, saving patients' life. I do procedures, as you know, for the arteries and the brain. So when I have a patient that has a big vessel in the brain completely shut down,
Yeah.
I go through the artery, the femoral artery, with catheters and wires. And the catheters and wires in the past used to be very, very stiff, and it was
Okay.
very difficult to get into the arteries of the brain. It would take a while. It would take a long time. Nowadays, I can tell you, I have probably more than 20 patients where I've gotten the catheters
Yeah.
into the arteries of the brain in less than 10 minutes.
So technology's getting better.
It's getting significantly better.
That's
And
good to know.
the first thing that we usually try to do is suction whatever is obstructing the blood flow in the vessel.
Very
Try
good.
to aspirate on the clot, clear it out of the way. I had patients opening the vessel within 6 minutes, 7 minutes, you know.
Nice.
But sometimes it takes a while. Yes.
Well, this has gone on. We've completed our interview. I want to thank you so much for coming
Of
on
course,
the
thank you for
show.
having
Anybody
me.
who needs to reach out, please call 561-499-7551. Dr. Dennys Reyes Candedo. Thank you, everybody.
Thank you.
Thank you. You did a
Appreciate it.
great
Thank
job.
you for having me.